Hi, I'm Tim Williams at Dwyer Williams Potter Injury Accident Attorneys. I'm the lead litigation attorney for our firm. Unfortunately, sometimes when people are injured, be it from a car crash or a fall on ice or downstairs, they can dislocate their knee. It can be the kneecap or the knee itself. And this can cause significant complications down the line. Let me show you what I mean. Looking at the model of the right knee, we can see that this is the outside of the knee here. This is the inside of the knee. Here's your shin bone, your kneecap, and then finally your thigh bone. And so when the knee bends, it bends like this. And we can see the kneecap glides nice and smooth inside of this area here. It's shaped kind of like it has an indentation in the joint. It has a little peak right here, and it just slides right in there. Okay? And we can also see, if we move the kneecap out of the way, that the joint of the knee, there's two indentations here, and the main joint of the knee, where the thigh bone moves along, it slides nice and smoothly within that knee. So what happens in a dislocation is you can either dislocate your patellar tendon, which is this, your patella, your kneecap, which is this right here, to the side, and I'll share with you, I've done that before, and it's not pleasant. And that's bad enough, but ultimately you can also dislocate the main body of your knee. And I can't do it because the ligaments are attached here, but you can imagine if this whole portion of the knee, the thigh bone, became unattached, either backwards or forwards or to the side of the two lower portions of the knee, or of your leg here, which is the thigh bone, and then your fibula. So the least of your worries would be if you dislocated your kneecap. That generally will dislocate to the side. It will usually pop back into place on its own. Be incredibly painful, not be able to bend your leg for some time. The danger there, though, is you can actually tear some of the nice smooth cartilages on the bottom side of the kneecap. Okay? And if you do that, it can cause damage and pain down the line as you continue to use your knee, either due to thinning or frank tearing. It can get caught in your knee joint itself, or you can end up with bone on bone, which is not pleasant. The more serious of the knee dislocations is if you dislocate your thigh bone from the lower portion of your leg. The problem with that is it can do damage to one or more of the structures that hold it into place, and those are the ligaments that hold it into place, or of this down here, which is the meniscus on either side. It can tear all that stuff. Incredibly complicated to try to reconstruct. Once that happens, you'll never have a knee like it was before the injury. So if you dislocate, so let's take the worst of the two. If you dislocate your thigh bone from the lower portion of your leg and you do damage underneath, that's fairly easy to prove. And I say fairly because insurance companies will still take the position that, well, some of the damage down below may have been there from prior sports you played, from injuries as a kid. I had one insurance company claim that because my client did concrete work that he must have had bad knees, even though he didn't have any problems with it. So they take sometimes ridiculous positions, but that's the nature of insurance, I suppose. The portion that becomes a little bit more problematic and harder to prove without doctors and lawyers is if you dislocate your kneecap and actually tear the underside of your kneecap. A lot of times it takes a while for that to come out. You may not know that you've had a problem with that for a year or sometimes more before you actually end up wearing all the way through that damaged portion of the underside of the kneecap. And now you are truly bone on bone and it hurts bad. And now you're looking at a surgery and you already settled your claim because you didn't hire a lawyer and didn't know any better. So this is why when you have a knee injury, it's very important to talk to someone that knows knee injuries, that knows what the complications might be down the line, that knows how to read chart notes and what your doctors are saying, and knows how to read between the lines of what the doctors put in their chart notes. Because if you settle, you're done. And if you don't settle, you know, at least you have a chance, a fighting chance. Hire a lawyer and let that person fight for you.